In this video, we're going to review placement of a percutaneous posterior column screw. The screw can be placed either antegrade or retrograde. Retrograde is, at least at Parkland, is less common. Usually we place these antegrade, and that's what we're going to show here. The skin incision is made medial to the iliac crest, and the screw is started at the brim of the pelvis. To get there, you have to elevate the iliacus muscle, which is usually done with a cob. It helps to relax the iliacus by flexing the hip. In the cadaver example shown here, that was not done, but that's typically what we do. So the surgeon makes the skin incision, releases the external oblique muscle from the crest, and then elevates the iliacus to get down to the brim. Then a pig sticker is placed. It can either be an offset pig sticker or an angled pig sticker, as in this case. And then the surgeon has to get the correct aim for placement of the guide wire. In this position, the C-arm, or the first image rather, is usually an iliac oblique view. The C-arm is in the iliac oblique view position here, and the surgeon has to aim the guide wire such that the wire will go behind the acetabulum. So the surgeon checks the position of the aim with the pig sticker, and then once he's happy on the iliac oblique view, the X-ray tech will roll the C-arm over to an AP view, and then sometimes to an obturator oblique view. Here, the C-arm is in the AP, and then he rolls over again to check an obturator oblique view. Once the aim is good, the guide wire is placed. Typically, we rotate back between iliac oblique and AP view to place the posterior column screw guide wire. Here the surgeon is asking for a iliac oblique, so you can see that the guide wire has just started and has entered the bone a little bit. The start point again is at the pelvic brim. Once the guide wire trajectory is good, it's advanced, and then the surgeon rolls over to check the position of the guide wire on the AP view. After the AP, you roll over to the obturator oblique. In this image, in this view, you can watch the guide wire pass down to the tuberosity, and you can make sure the guide wire doesn't exit laterally. You go back to the AP to check the position again, make sure you don't exit medial or lateral, and then once more back to the iliac oblique view to check the position of the guide wire behind the acetabulum. Once the guide wire is in a good position, the length is measured with a measuring stick. Once the appropriate length screw is found, the screw is placed. Again, flexion of the hip will help relax the iliacus and prevent trauma to the iliacus muscle, and also protect the femoral nerve. In the cadaver, this wasn't done. As the screw is passed down the posterior column, the surgeon watches on the iliac oblique. It is difficult to tell if you're seated on the brim in the iliac oblique. You can usually check it with your finger, or you can roll over and check it on an AP, which will give you a better view of the top of the brim. Once the screw is in a good position, the guide wire is removed. This portion is complete.